Hello, everyone. My name is Grace. This summer, I spent 8 weeks interning with the Rutgers Cancer Health Equity Institute under Dr. Anita Kinney, working on a project called eye care. So I'm just going to give you guys a brief introduction on hereditary cancer syndromes, family communication, and some of the disparities in utilization of genetic testing services. So the BRCA1 and 2 gene mutations increase the risk of breast and ovarian cancer in females and prostate cancer in male carriers significantly. Lynch syndrome mutations primarily increase the risk of endometrial cancer for female carriers and colorectal cancers for all who are diagnosed. However, cancer risk can be managed if carriers are aware of their status. And this brings me to the importance of family communication. HIPAA prevents care providers from disclosing the genetic testing results of at-risk or of diagnosed mutation carriers to those carriers' relatives. So consequently, cascade testing, which is just the identification of mutation carriers, relies heavily on family communication of test results. However, this is not optimal in the case of BRCA1 and 2 gene mutations, as well as Lynch syndrome. So those disparities and gaps in conjunction with the numerous disparities in the utilization of genetic testing services cause many preventable deaths. Just to discuss briefly some of those disparities, there is a gender disparity, which is very drastic for BRCA1 and 2 gene mutations, just due to the societal association of BRCA1 and 2 gene mutations with breast cancer. So males are significantly less likely to seek testing and utilize genetic testing and counseling services. There are racial and ethnic disparities as well as socioeconomic and cultural. And what I spent most of the summer researching is how chatbots could be used as an alternative care delivery model to address some of these disparities and these issues in family communication. So the cool thing about chatbots, also known as conversational agents, is they have the potential to address the national shortage of genetic counselors, disparities in genetic testing and awareness, and overall just save lives. So my primary internship objective was to synthesize literature regarding cancer health disparities in family communication, cascade testing, the focus group data from Project Eye Care, and the research detailing existing technological interventions in order to provide recommendations for the development of a chatbot and online genetic education intervention. So I'm just gonna go a bit into Project Eye Care, which was my main focus. So Project Eye Care was a set of 3 focus groups, the research team, and we basically sought to recruit a diverse set of cohorts, including males and those underrepresented in research. And the goal of this was to gain feedback for a technological intervention, a website and chatbot that facilitates cascade testing through enhancing family communication of genetic testing results. So I'm just going to hop over to the results. So from the focus groups, after analyzing the data, coding the data thematically using in vivo, we were able to see that overall participants really enjoyed the idea of a website geared towards helping those with BRCA1 and 2 mutations in Lynch syndrome share the results with family members. That was very well received. However, the idea of a chatbot was less well received, mostly due to AI hesitancy, and a lot of the participants cited their bad experiences with consumer chatbots. But overall, despite this, most participants reported a willingness to use a chatbot-based intervention, which was great news for the research team. So as for my specific research contributions, I presented a flash talk at the Cancer Health Equity Institute retreat in June, detailing the overall gist of Project Eye Care. I compiled a list of cancer organizations to aid with recruitment, conducted a thorough literature search, and then regarding actually getting participants for the focus group studies, I was involved, me as well as another research assistant, in recruiting and consenting focus group participants. We sent out surveys and study reminders. I helped create a Microsoft Teams participant user guide and attended all 3 focus groups, in addition to conducting quality assurance checks on participant surveys and attending weekly research team meetings. So for the actual data analysis part of this internship, I conducted a pretty thorough literature search and then synthesized that information along with the focus group results into a 36-page report detailing significant findings and technological recommendations. And this was done after me and the other research assistants created an a priori codebook, coded and analyzed the focus group transcripts in Microsoft Teams. So significant findings, as well as my technological recommendations, were then presented to the research team. And that was how my internship concluded. But just reflecting on the whole experience, I learned a lot very, very quickly. In the future, I definitely want to forge a career as a physician that merges clinical practice, research, and health equity. I'm looking forward to engaging in more interdisciplinary clinical research endeavors. And speaking to genetic counselors and conducting literature reviews really made me aware that many physicians lack training and awareness regarding specifics of genomics and genetic testing counseling services. And yeah, I'm just overall looking forward to seeing the eventual technological eye care chatbot website intervention. But just briefly going over some of the skills that I developed and the lessons I learned. So I did not know I had never done recruiting before. So this internship gave me experience with community-based and cold call recruitment, consenting participants, familiarity generating and running reports in REDCap, thematic analysis using in vivo, as well as EndNote proficiency. And then some lessons I learned. I guess the most significant lesson I learned was the importance of partnering with the community that one seeks to serve when designing the intervention. And when conducting clinical research, it's very important to consider whose voices are being left out of the conversation, and sort of going that extra step might reveal what needs aren't being met. Yeah, and then also due to COVID-19, a lot of complications arose during the study. So just seeing how those issues were handled and troubleshot was really useful for me. And I plan on taking that awareness into my other clinical research experiences. Yeah, but overall, I'm extremely grateful for the opportunity to have worked with Dr. Kinney's team. I learned a lot during my 8-week internship, gained many skills that I will carry over to my future research and clinical endeavors. Thank you all for listening.